The following videos are a demonstration of the basic skills required to care for a child with a tracheostomy. Now, this is not meant to replace hands-on training, but to provide an additional resource. Personal protective equipment, or PPE, gloves, eye protection, mask, and gown as indicated. A blanket roll, tracheostomy tube of the same size, and tracheostomy tube one size smaller uncuffed. Drain sponge or other barrier. Manual ventilation bag with oxygen source. Scissors, stethoscope, suction equipment, syringe to deflate the cuff if the trach is cuffed, sterile water if the trach is cuffed, trach ties, water-soluble lubricant, pulse oximeter attached to the patient. Prepare for trach change. Apply tracheostomy ties to the new tracheostomy tube in advance to secure the tube in a reduced amount of time. Prepare the new tube while keeping the tube tip sterile. If the child has a cuffed tracheostomy tube, inflate the cuff with sterile water or air depending on the manufacturer direction to ensure that it works properly. Ensure that the cuff is deflated before you insert the new tube. Put the obturator in the tracheostomy tube before placement. Coat the new tracheostomy tube tip with a small amount of water-based lubricant. Ensure that the child's vital signs and indicators of adequate oxygenation and ventilation are being monitored. Perform hand hygiene and don gloves. Don eye protection, mask and gown as indicated. Suction secretions as indicated. Position the child so that his or her head is slightly extended and the chin is pointed towards the ceiling, with the stoma site visible and easily accessible. Place a blanket roll under the child's shoulders. Ensure adequate visibility of the stoma site, especially in an infant or obese child with a small neck that limits visibility. Provide increased ventilatory support and hyperoxygenation based on the child's clinical condition, and pharmacologic sedation as indicated. Person 1, hold the current tracheostomy tube securely. Person 2, cut and remove the ties. Person 1 is responsible for ensuring that the trach stays in place. Person 2, if the child has a cuffed tube, deflate the cuff by withdrawing the water or air from the cuff with a syringe. Person 1, when the secondary caregiver is ready, remove the current tracheostomy tube from the stoma. Person 2, immediately insert the new tube with the curve pointed downward, following the curve of the tracheal stoma. If resistance occurs, remove and try again. Do not use force. Person 2, remove the obturator. Hold the new tube securely. Person 1, attach the ventilator tubing or an oxygen delivery device to the new tracheostomy tube as ordered. Person 1, auscultate the child's breath sounds bilaterally and perform a clinical respiratory assessment. Monitor the child for unequal breath sounds or signs of respiratory distress. Person 1, secure the trach ties. Place one finger between the ties in the neck on each side of the neck one at a time and readjust the ties to an acceptable tension if necessary. Person 2, when you've determined that the trach ties are secure, you can let go of the tracheostomy tube. If there is a cuff, inflate it with sterile water or air per the manufacturer's guidelines to the volume ordered. These videos are available for you to review as often as you would like. If you have any questions about any of the skills shown here, please ask a member of your healthcare team.